Okay. Tonight our class is on plantar fasciitis. And as we look at the body, a lot of people think plantar fasciitis, unless you have it or know someone that has it, it's really not that familiar as a phrase. Okay? When we talk about plantar fascia, the plantum, think literally something being planted. So we are talking about the foot. And plantar flexion is when the foot, in essence, is pointing downward. Fascia is connective tissue and itis is inflammation. So it's the connective tissue that basically runs between the heel bone and the metatarsals of the foot. And this connective tissue band that goes across the bottom of the foot is the plantar fascia. What we see with plantar fasciitis is it is a response to the body's attempt to keep me on the ground. Okay? When we toe off in our stride, the foot actually goes through what's called a windlass response. And that windlass response is, or windlass actually, is the plantar fascia actually acts as a connective tissue that tightens this bridge or arch. So when we step or push off, it actually acts as a gait strengthener and helps to push off and give us power in our gait. And that's what happens with the plantar fascia. So people who have plantar fasciitis say, my biggest symptom is I have pain in the morning, my very first steps. When I step out of bed and put pressure on my feet, and that plantar fascia is stretched, it causes irritation in the feet. Okay? Amazing thing that we see is people with chronic plantar fasciitis oftentimes will have an x-ray, and what they'll see on the x-ray is what is diagnosed as a heel spur. This area will actually appear to have a white spur on it on the heel. But a true heel spur, according to the orthopedists, at least the ones that I have visited and done rounds with, they say when they actually open that up to remove that spur, that it isn't bony hard at all. It actually is where this connective tissue has been bound to the body, that there will be micro tears and the body will lay down calcium in this area, and it looks like a spur on x-ray, but when they open it up, it actually has the consistency of toothpaste, and they have to expose it to the air long enough that it actually hardens for them to be able to then extract or remove it. Kind of fascinating, I think. So the plantar fascia then is this connective band that gives this tightening effect to the sole of the bottom of the foot in toe off in our gait. And plantar fasciitis then is anywhere along this, but primarily will be this posterior third of the plantar fascia that becomes very irritated or inflamed. Now, most people are looking for what's the cure. And if we look at the correction of that, if we go to some of our friends that are specialists in the feet, their cure would be then, if this is irritated, let's get something that would basically splint that foot. And the splinting of the foot, of course, is some type of an orthotic. So orthotics are very commonly used. Other people have used anything from a water bottle that's been frozen, and then their first instruction in the morning is to ice it. So they'll ice their plantar fascia in a water bottle or a water cup. And then if you've been to an athletic trainer or a physical therapist, there's a taping technique for taping the arch, which gives a little break from that. And the tape on that is kind of a fun taping technique, really, when you look at how it's done. What the physical therapist will do, or the athletic trainer will do, is take the tape, and they'll take the tape and basically lay down straps of tape across the bottom of the foot this way, and then lock it in on the sides, and then come back and tape in this way to support the arch. Then a lot of times people will stand up and say, oh, that feels better, as long as the tape's on. Okay? We look at plantar fasciitis, though, as a brain-based problem. And we'll actually explain that from this perspective. Not that any of these are wrong. We just believe that according to the work of Professor Carrick, there's a faster way to correct this, and this is actually a manifestation of brain. Okay? Remember, we've talked before, if a person has a perception, or if the body has a perception of sway that is one direction or another, meaning if I perceive when I'm standing that I'm falling forward, in a forward fall, my eyes will go upward. Remember that? So they're always trying to stay on the horizontal. If I'm falling forward, I will have a superior gaze, so I can keep looking out at the horizon. So here's a little tree out here, and on the horizon I'm trying to see or stay focused on that horizon. What I'll actually do if I'm falling forward is keep then my eyes in a superior gaze. If I have a posterior sense of fall, so if I'm falling backward, in order to keep my eyes on the horizontal, my eyes will go downward, correct? So based off of those two perceptions, then we actually have a continuum of what is the body attempting to do. So tonight we'll actually give a correction for two things. If I'm falling forward, my body will be trying to push me back, which will then make the fronts of my legs sore, and this is a condition called
Shin Splints.
Shin Splints. Thank you.
Me.
Okay?
But since doing the red thing before, I haven't noticed it when I...
Correct.
Sorry, go ahead.
That's exactly
it's
right.
It's
Yay!
It's cool.
You've learned it.
Yeah, and anyways, and
That's
I didn't
important.
realize it until you talked about this last, and I'm like, oh my goodness, I don't have shin splints anymore. And it was just surprising.
Isn't that neat?
Yeah.
So thank
Totally.
you. Thank you.
It was cool.
So shin splints then are going to be a product of an anterior sway. And let me just turn to this side again so I can write it more legibly. Shin splints are associated then with anterior center of pressure. Okay? Or in essence, I feel like I'm falling forward. Okay? If I feel that I'm falling forward, my eyes go in a superior gaze, and that's to correct that center of pressure, and my resistance of my body from falling forward then in my feet becomes shin splints, or a manifestation. Okay? If I'm therefore falling backward, my eyes are in an inferior gaze, and my body, to keep me from falling, will do what with my feet? Claw or grip the ground, right? So just like a parakeet, have you ever had a parakeet land on your finger or hold a parakeet on your finger? It will claw and hold itself stable on your finger. Similarly, our own feet attempt to do the same thing. If I have a sense that I'm going to be falling back, my body's trying to claw and grip myself forward, and so we'll end up then with plantar fasciitis. Again, let me try to write that so it's legible. So, again, I'll have an inferior gaze with a posterior fall. Right? So how do I then bring my body forward? If I'm in an inferior gaze, what would my exercise be? A superior gaze, right? And vice versa. So if my eyes are already stuck in a downward gaze, I want to try to correct that by bringing my eyes upward or into a superior gaze. And so we'll actually do then a saccade or visual saccade superiorly. Okay? So here's an example. Remember, a little optokinetic strip or a visual saccade strip, all we're looking at is how the eyes move as this is passed in front of the eyes. Okay? So what we're looking for here, and again for those who are neurology learners from Professor Carrick's class, if we do visual saccades that go from side to side, so from left to right or right to left, depending upon presentation of the person, a lateral saccade, or a horizontal saccade causes a slowing of midbrain. Okay? Whereas superior or inferior or midline vertical saccades cause an increase, let's actually write it down, increase in the output of the midbrain. Okay? So that's more important again for those who are the neurology learners. So horizontal saccades will cause slowing of the midbrain, and vertical saccades actually will cause an increase. So if I have plantar fasciitis and I have a perception that I'm falling backward, my feet will claw, and I want my eyes to come into a superior saccade. So we'll actually bring the eyes upward like this. Okay? Pretty easy. As well as then if I have the shin splints, we're going to go downward and then have them pursue downward. And it's changed, hasn't it?
Yeah.
Pretty neat.
Cool.
Very cool. And here's the very coolest thing about this. When the saccades are done in the correct direction, a person will come in with tremendous pain, and you'll touch the heels, and then you'll have them stand, and then you'll do the saccade in the right direction, and they'll stand again, and their plantar fasciitis will be reduced significantly, instantly. And within a matter of a couple of days, it's completely gone. And those are things that plague people for a lifetime. So, pretty neat fix, and pretty quick fix, very powerful. Okay, remember when you're visualizing an optokinetic saccade, you're actually seeing the brain's perception of the somatotropic map, meaning the brain has a map of the body, and when you see the eyes and the way that they're moving, again, what you're looking for is the health of the brain. You're actually seeing the eyes go do, 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 do. Can you see my eyes do that when they go across? What you're actually seeing is the health of the brain in that type of a visual saccade. Okay? Same thing in these upwards or downwards. You're actually seeing, again, the brain's somatotropic or body map overall. And so a lot of times we'll actually use those saccades to help to heal the brain post-injury, post-head trauma, some type of manifestation of post-sickness or whatever the case may be that may have slowed or changed or altered the brain's dedication to cells for that map of the body. Okay, so let's say I've had this surgery on my arm. At one time there was a lot of cell power dedicated to protecting and guarding that arm. So my visual saccade or map of that area may have been distorted slightly because of how much dedication or emphasis was in that area. A visual saccade or optokinetic may help to restore my body's normal saccade or somatotropic map. So again, kind of fascinating. And that's our presentation on plantar fasciitis. Thanks.